Thank you for taking care of patients suspected or known to have COVID-19. These are uncertain and frightening times for everyone, most so for patients and their families. At St. Mary's, we are working to deliver the most up-to-date practices regarding care of patients with COVID-19. This video is meant to address the initial management of patients under investigation, as well as the protocols related to contact-based precautions and disposition of patients on different respiratory therapies. The presentation will be broken into a series of questions that are frequently raised on the wards regarding the care of PUIs. The first question is, what personal protective equipment is required when taking care of PUIs? For PUIs who are not on oxygen, or for those who are requiring oxygen on normal nasal cannula, contact and droplet precautions are instituted. These precautions include eye protection, simple face mask, gown, and gloves. For PUIs who are undergoing aerosolizing procedures or those on respiratory support above normal nasal cannula, contact and airborne precautions are instituted. These precautions include eye protection, N95 respirators or above, gown, and gloves. Procedures considered aerosolizing include nebulizers, chest physiotherapy, deep suctioning, nasogastric tube and Dobhoff tube placement, endoscopy, and bronchoscopy. Respiratory support modalities considered aerosolizing include nasal cannula with reservoir, otherwise known as oximizer, high-flow nasal cannula, otherwise known as airbo, and non-invasive positive pressure ventilation, such as CPAP or BiPAP. In general, these aerosolizing procedures should only be performed in negative pressure rooms or negative pressure areas. We will discuss the disposition of PUIs requiring these aerosolizing procedures later in the video. What are essential points of management of PUIs? Continuous pulse oximetry. All PUIs should be placed on continuous pulse oximetry. This is important because many PUIs do not appear short of breath despite having hypoxia. Additionally, all patients who have an SpO2 equal to or less than 94% on room air are candidates to receive investigational therapies for COVID-19. Labs. All PUIs should have a CBC, CMP, type and screen, ferritin, C-reactive protein, D-dimer, and LDH obtained on admission. Obtaining a type and screen is important because it is required prior to giving convalescent plasma. Restricted fluid strategy. In general, PUIs and patients with confirmed COVID-19 should not be on supplemental fluids. Giving excess fluids may worsen hypoxia. Of course, fluids may be necessary in patients who are volume deplete, but in general, maintenance fluids should be avoided. Nebulizers. Nebulizers are considered aerosolizing procedures and may be only given in negative pressure areas. If nebulizers are ordered on the floor, do not give them and contact the attending physician. Metered dose inhalers may be used instead. Prone positioning. PUIs who are hypoxic should be encouraged to lie on their stomach or side as much as tolerated. This often will improve their oxygenation. What is silent hypoxia? Patients with COVID-19 often present with shortness of breath. However, their degree of hypoxia is often out of proportion to what you might expect given their relatively mild symptoms. Patients may report feeling well despite being severely hypoxic. This has been termed silent hypoxia. A patient may look okay, but this should not give you reassurance. If PUIs supplemental oxygen needs are increasing, let the attending physician know immediately. Silent hypoxia underlines the importance of continuous pulse oximetry. How should patients be isolated with regard to their level of respiratory support? At St. Mary's, we have determined that all patients who require greater than 4 liters of supplemental oxygen via nasal cannula should be transferred to a negative pressure room or a negative pressure area. PUIs who require greater than 4 liters of supplemental oxygen via nasal cannula are at high risk for respiratory deterioration and may need higher respiratory support. The following areas in the hospital are negative pressure or can be converted into negative pressure. Individual negative pressure rooms include 345 and 3 TCU, 388 and 3 ICU, 405 and 407 on 4 West, 487 on 4 East, 488 and 4 ICU, and 552 in the OB ward. These individual rooms are preferred for PUIs. Entire wards that can be made negative pressure include 3 ICU, 4 ICU, 4 TCU, and the 4 East South Wing that include rooms 473 through 487. These are preferred for patients diagnosed with COVID-19 who are on aerosolizing oxygenation modalities or who are intubated. Please call the house supervisor to discuss available rooms. Alert the attending physician to any PUI requiring more than 4 liters of oxygen via nasal cannula. What should be done when a patient tests positive for COVID-19? Please alert the attending once you are informed of a positive COVID-19 result. This allows for the timely administration of investigational therapies. Patients with confirmed COVID-19 should be transferred to the appropriate COVID-19 unit with regard to their level of respiratory support. These areas change with time in response to overall hospital patient volume, but include the areas discussed previously. Call the house supervisor with any specific questions about patient disposition. What investigational therapies for COVID-19 are available at St. Mary's? Investigational therapies for COVID-19 patients include dexamethasone, remdesivir, and convalescent plasma. Dexamethasone may be given to PUIs who are hypoxic and strongly suspected to have COVID-19. Remdesivir and convalescent plasma require a patient to have tested positive for COVID-19 prior to being given. Evidence does support the use of these therapies. However, we do not know with certainty that they are absolutely effective. The pandemic and our approach to COVID-19 are always changing. We will let you know changes as timely as possible. Thank you for taking care of patients under investigation for COVID-19. Your courage and compassion make a tremendous difference for our patients. Please reach out to us with any questions or concerns. We are here to support you. We are all in this together.